আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহ। এখন আমরা একটি ছোট লেকচার নেব, সেটা হলো ল্যাবরেটরি ডায়াগনোসিস অফ সেক্সুয়ালি ট্রান্সমিটেড ইনফেকশনস। ল্যাবরেটরি ডায়াগনোসিস অফ সেক্সুয়ালি ট্রান্সমিটেড ইনফেকশনস, আমরা সেক্সুয়ালি ট্রান্সমিটেড ইনফেকশনস বা STI এর উপরে আগে একটি লেকচার নিয়েছি। সেখানে এটিওলজি, ম্যানেজমেন্ট, সিন্ড্রোমিক ম্যানেজমেন্ট ইত্যাদি বিভিন্ন বিষয় নিয়ে আলোচনা করা হয়েছে। Sexually transmitted infections একটা public health problem, and there are projects in the control of sexually transmitted infections, and this lecture is what is the use of lab in STI control. It is required for screening and detection among the mass population, screening asymptomatic people in a high-risk population, to diagnose single and mixed infection, to improve diagnostic value of syndromic management, detection of infection in asymptomatic population, epidemiological data like prevalence incidence, testing for antimicrobial resistance, sentinel surveillance, and accurate etiological diagnosis. For these 9 reasons, we need laboratory test for the control of STI infection. What are the diagnostic tests available for STIs? Of course, microbiology deals with microscopic examination, and by weight mount, we can diagnose many infections, a few infections like Trichomoniasis, Candidiasis, bacterial vaginosis. Easily they can be diagnosed by weight mount, that is by normal saline preparation. Gram staining helps in diagnosis of gonorrhea and bacterial vaginosis, and a special type of microscopy, dark field microscopy, helps in diagnosis of syphilis. Immunological test based on antigen detection is helpful for diagnosis of gonorrhea and chlamydia. Antibody test for syphilis and HIV. Vaginal pH detection helps in diagnosis of bacterial vaginosis. Culture is important. Culture plays a very important role in Neisseria gonorrhoeae, Candida albicans. And DNA detection is helpful for diagnosis of human papillomavirus, and PCR, that is NAT, nucleic acid amplification test, is also helpful for human papillomavirus. What are the limitations of laboratory test? Laboratory test is costly, time consuming, need trained manpower, need expensive equipments when PCR or immunofluorescence are used. Delay in diagnosis and treatment. Not all tests are highly sensitive or specific. And we must remember, when we will use the laboratory testing for control of STI, some simple lab test can assist in enhancing the effectiveness of syndromic management, because say for example, urethral discharge, it can be by Neisseria gonorrhoeae or can be by non-gonococcal urethritis. If we can differentiate by lab test, we can effectively manage the syndromic management. But we must also remember that syndromic management should be started based on the guideline, not waiting for the result of the laboratory. Lab test can be useful for a specific diagnosis, and also it helps in collecting epidemiological data, and sensitivity is also important. Let us discuss in short about some important STI. Gonorrhea is one of the very old classical venereal diseases. The laboratory diagnosis is based on direct microscopy of appropriate specimen and culture also. Immunological tests are very rarely used due to immunological variation in the antigenicity of Neisseria gonorrhoeae. What are the steps? We should take the urethral discharge in acute stage, prostatic massage fluid in case of male, in chronic stage. In case of female, endocervical swab, not vaginal swab, because the endocervix has got columnar epithelium in which Neisseria gonorrhoeae can adhere. In case of abnormal sexual behavior, we can consider pharynx, swab from pharynx, rectum, and in case of children, conjunctival swab. Microscopy of gram stain smear is practically done. It is more than 80% sensitive and specific in case of male, but in case of female, if we do not get intracellular gram-negative diplococci, we cannot report it with high specificity. Direct immunofluorescence can be done. Culture is necessary not only for diagnosis but also for sensitivity test. But culture in case of gonorrhea, it is to be handled very carefully. The specimen, that is urethral discharge or prostatic massage fluid, should be directly inoculated to culture medium. Otherwise, by drying or by freezing, it will die. Neisseria gonorrhoeae will die. If it is to be transported, should be transported at -4 within 4 degrees centigrade and processed within 48 hours. Nowadays, molecular tests are used, especially the real-time multiplex PCR, and it is becoming popular day to day. Regarding laboratory diagnosis of syphilis. Laboratory diagnosis of syphilis is based on a special type of microscopy, that is dark ground microscopy and immunological test. Nucleic acid basic test can also be used. Culture cannot be done, and gram staining or ordinary light microscopy cannot be used. So what are the specimen? A specimen from the genital site, rash for dark ground microscopy, and blood for serological test, and PCR from the exudate. Dark ground microscopy, because Neisseria gonorrhoeae is very thin and cannot be stained by gram staining method. Dark ground microscopy is very helpful. Direct fluorescent test also be done. Serological test, there are 2 types of serological test, non-treponemal and treponemal. And serological tests are practically done for diagnosis of syphilis. Non-specific test includes non-treponemal test, rapid plasma reagent, venereal disease laboratory test. A specific test uses the treponemal antigen, and the common tests are treponemal pallidum hemagglutination test, treponemal pallidum particle agglutination test, ICT for treponemal pallidum, fluorescent treponemal pallidum antibody test, fluorescent treponemal pallidum IgM test for congenital syphilis, and treponemal pallidum immobilization test, of which TPHA and ICT for syphilis are point of care test and used very frequently. And for congenital syphilis, FTP IgM can be used. Differences among the comparison between non-treponemal and treponemal test. Non-treponemal tests like VDRL and reagent, VDRL and rapid plasma reagent are simple and cheap. Treponemal tests like TPHA or treponemal pallidum particle agglutination test simple but a little bit costly. Non-treponema tests are sensitive but non-specific. They cannot distinguish between active and non-active. They can distinguish between active and non-active infections if quantitative VDRL or quantitative RPR tests are done. Treponema test cannot distinguish between active or past infection. Once infected, usually it remains for life, even if the patient is cured. That's why it is known as immunological scar. For non-treponema test, we require electricity, refrigeration, trained personnel, and serum is used. Treponema test is a point of care test. No instrument is required. Whole blood, serum, or plasma, anything can be used. With VDRL and RPR, biological false positive reactions may occur. In case of treponema test, they are specific without false positive reactions. There are false negative also with excessive antibody, which is known as proton phenomenon. But in case of treponema test, here usually there is no proton effect. This is a chart in which we can see the comparative sensitivity and specificity of different tests in different stages of syphilis. VDRL is highly sensitive and specific in secondary syphilis. RPR, both secondary and latent syphilis, is sensitive and specific. TPHA, it is very good test for secondary syphilis and latent syphilis and tertiary syphilis also. Primary syphilis, it misses a good number of cases. Enzyme immunoassay is very good test with high sensitivity and specificity in case of primary, secondary, and latent syphilis. Laboratory diagnosis of chlamydia. You know, chlamydia cannot be cultured in artificial media, and so chlamydia is an intracellular organism which produces inclusion body. So based on cytological test for detection of inclusion body, culture in the cell line, detection of antigen and antibody, and also DNA-based test. Gold standard for chlamydial infection diagnosis is NAT, that is nucleic acid amplification test or PCR. And specimens to be taken from cervix, penis, or rectum, and urine in case of male, and self-swabbing can be done in case of females. So chlamydial test, this is a very old test in which the infected cell, if stained with iodine, inclusion bodies can be found, but it is not that sensitive, only 40 to 60% sensitive. Culture can be done in tissue culture, and from the tissue culture also you can see the inclusion body. These tests are not practically used for diagnosis of chlamydia. Antigen detection test from swab, which detects group-specific lipopolysaccharide and strain-specific outer membrane protein, are sensitive and specific. Antibody detection from blood cannot distinguish between current or past infection, but detection of high titer IgM antibody can be helpful. Nucleic acid probes are the gold standard for chlamydia test, PCR, and it is highly sensitive and specific. Laboratory diagnosis of human papillomavirus. You know, some strains, some types of human papillomavirus may lead to cervical cancer, and a good number of women suffers from cervical cancer. The laboratory diagnosis of human papillomavirus is, there are many options. Number one is very simple, visual inspection by acetic acid, popularly known as VIA. It is done in most of the centers, starting from Upazila to tertiary centers, by the nurses and outdoor gynecologists. Colposcopy along with VIA is also very good screening test. Histopathology can be done. where coilocytes indicate the presence of productive human papillomavirus. For antigen detection, in situ hybridization is available. Nucleic acid detection test, there are hybrid capture system, PCR and real-time PCR. And to diagnose the cervical cancer, there is a rapid test, OncoE6 protein, which can predict cervical cancer by HPV. Actually, it does not detect the HPV, but it detects a product, OncoE6, which is the carcinogen, which is the factor that causes cancer in the women. Laboratory diagnosis of HIV/AIDS, it is based on immunological test and PCR. Virus isolation rarely done. Immunological test, there are both antigen and antibody-based test. Detection antibody by ELISA, which is confirmed by Western blot or line immunoassay. There are some rapid tests for antibody detection also, like ICT and agglutination. Detection of antibody, the P4 antigen, detection of antigen, P4 antigen can be detected by ELISA, and this antigen detection is helpful during the window period between the infection and development of the antibody. Nucleic acid based test, RT-PCR, very sensitive and can measure the viral load. Laboratory diagnosis of trichomoniasis is very simple. Vaginal discharge, microscopy of the vaginal discharge, tropozoid form can be found practically. PCR also popular nowadays. Laboratory diagnosis of Candidiasis, microscopy and culture, both are important. PCR can also be done. And on microscopy, weight preparation or gram stain preparation shows body yeast. Culture can be done in bacteriological or fungal media. And unlike other fungus, its growth occurs only in 48 hours, within 48 hours to be confirmed by germ tube test. But for other fungus, most of the fungus takes 2 weeks to grow. But exception is the Candidiasis. 2 exceptions. One, it can grow in bacteriological media as well as fungal media, and time for growth is only less than 48 hours. Thanks a lot for patience hearing. Assalamu alaikum wa rahmatullah.